D metformin, and propylthiouracil inhibits thyroid hormone synthesis and peripheral conversion of T4 to T3. Q862. Which drug is a cephalosporin antibiotic, a ceftriaxone B doxycycline C azithromycin D ciprofloxacin, and ceftriaxone inhibits bacterial cell wall synthesis. Q863. Which drug is commonly used in rheumatoid arthritis, A methotrexate B omeprazole C digoxin D diazepam, and methotrexate suppresses immune activity and reduces joint inflammation. Q864. Which drug is used in status epilepticus, A diazepam B atenolol C aspirin D metformin, and diazepam enhances GABA activity and rapidly controls seizures. Q865. Which drug is an osmotic diuretic, A mannitol B furosemide C spironolactone D hydrochlorothiazide, and mannitol increases osmotic pressure and promotes water excretion. Q866. Which drug is commonly used in glaucoma, A timolol B atenolol C propanolol D digoxin, and timolol decreases aqueous humor production and lowers intraocular pressure. Q867. Which drug is used as an antiplatelet agent after myocardial infarction, A clopidogrel B heparin C warfarin D morphine, and clopidogrel inhibits ADP-induced platelet aggregation. Q868. Which drug is a selective serotonin reuptake inhibitor, A sertraline B haloperidol C diazepam D lithium, and sertraline increases serotonin levels in the CNS and is used in depression. Q869. Which drug is used for fungal skin infection, A clotrimazole B acyclovir C penicillin D ciprofloxacin, and clotrimazole damages fungal cell membrane by inhibiting ergosterol synthesis. Q870. Which drug is used as an antiarrhythmic agent, A amiodarone B aspirin C metformin D omeprazole, and amiodarone prolongs cardiac action potential and stabilizes abnormal rhythms. Q871. Which drug is used in peptic ulcer disease as an H2 blocker, A ranitidine B omeprazole C pantoprazole D antacid, and ranitidine blocks histamine H2 receptors and decreases gastric acid secretion. Q872. Which drug is commonly used in migraine prophylaxis, A propanolol B salbutamol C adrenaline D dopamine, and propanolol reduces frequency of migraine attacks by beta blockade. Q873. Which drug is used for opioid dependence treatment, A methadone B diazepam C aspirin D digoxin, and methadone is a long-acting opioid used in opioid substitution therapy. Q874. Which drug is used in constipation as a bulk laxative, A psyllium B lactulose C senna D bisacodyl, and psyllium absorbs water and increases stool bulk. Q875. Which drug is a carbonic anhydrase inhibitor, A acetazolamide B furosemide C mannitol D spironolactone, and acetazolamide inhibits carbonic anhydrase enzyme and reduces bicarbonate reabsorption. Q876. Which drug is used in ventricular tachycardia, A lidocaine B omeprazole C aspirin D cetirizine, and lidocaine suppresses abnormal ventricular electrical activity. Q877. Which drug is commonly used in COPD management, A tiotropium B atenolol C digoxin D metformin, and tiotropium is a long-acting anticholinergic bronchodilator. Q878. Which drug is used in anaphylaxis to improve blood pressure, A adrenaline B propanolol C verapamil D aspirin, and adrenaline stimulates alpha receptors causing vasoconstriction and increased blood pressure. Q879. Which drug is a broad-spectrum penicillin, A amoxicillin B ciprofloxacin C doxycycline D azithromycin, and amoxicillin inhibits bacterial cell wall synthesis and acts against many bacteria. Q880. Which drug is used in tuberculosis causing orange discoloration of urine, A rifampicin B isoniazid C ethambutol D pyrazinamide, and rifampicin commonly causes orange-red discoloration of body fluids. Q881. Which drug is used as a sedative hypnotic? A. Phenobarbital. B. Aspirin. C. Metformin. D. Omeprazole. Ans. Phenobarbital depresses CNS activity and induces sleep. Q882. Which drug is commonly used for nausea during chemotherapy? A. Ondansetron. B. Lactulose. C. Digoxin. D. Aspirin. Ans. Ondansetron blocks serotonin receptors involved in vomiting reflex. Q883. Which drug is used in type 1 diabetes mellitus? A. Insulin. B. Metformin. C. Glibenclamide. D. Pioglitazone. Ans. Insulin replaces deficient endogenous insulin in type 1 diabetes. Q884. Which drug is used as an antifungal in candidiasis? A. Nystatin. B. Acyclovir. C. Ciprofloxacin. D. Doxycycline. Ans. Nystatin binds fungal cell membrane sterols causing leakage of cell contents. Q885. Which drug is used in severe pain management? A. Morphine. B. Paracetamol. C. Aspirin. D. Ibuprofen. Ans. Morphine acts on opioid receptors producing strong analgesic effect. Q886. Which drug is commonly used in anxiety disorder? A. Alprazolam. B. Digoxin. C. Aspirin. D. Omeprazole. Ans. Alprazolam enhances GABA-mediated CNS inhibition and reduces anxiety. Q887. Which drug is used in iron overdose poisoning? A. Deferoxamine. B. Naloxone. C. Atropine. D. Vitamin K. Ans. Deferoxamine chelates excess iron and promotes its excretion. Q888. Which drug is used as an antiprotozoal agent? A. Metronidazole. B. Penicillin. C. Ceftriaxone. D. Azithromycin. Ans. Metronidazole damages DNA of anaerobic organisms and protozoa. Q889. Which drug is used in hyperlipidemia? A. Rosuvastatin. B. Metformin. C. Omeprazole. D. Diazepam. Ans. Rosuvastatin inhibits HMG-CoA reductase and lowers cholesterol levels. Q890. Which drug is commonly used as an anthelmintic? A. Albendazole. B. Ciprofloxacin. C. Doxycycline. D. Fluconazole. Ans. Albendazole inhibits glucose uptake in parasitic worms leading to their death. Q891. The leukotriene antagonist, A. Montelukast. B. Salbutamol. C. Theophylline adrenaline. Ans. Montelukast blocks leukotriene receptors and decreases inflammation. Q892. Which drug is used for emergency control of seizures? A. Lorazepam. B. Aspirin. C. Digoxin. D. Atenolol. Ans. Lorazepam rapidly enhances GABA activity to stop seizures. Q893. Which drug is commonly used as an antacid? A. Magnesium hydroxide. Ans. Magnesium hydroxide neutralizes uric acid in the stomach. Q894. Which drug is used in bacterial meningitis as a third-generation cephalosporin? A. Sfotaximi. B. Penicillin. C. Doxycycline. D. Gentamicin. Ans. Sfotaximi penetrates CSF effectively and inhibits bacterial cell wall synthesis. 195. Which drug is used for motion sickness and vertigo? A. Meclizine. B. Aspirin. C. Metformin. D. Omeprazole. Ans. Meclizine blocks H1 receptors and reduces vestibular stimulation. Q896. Which drug is commonly used in hypertension as a beta blocker? A. Metoprolol. B. Salbutamol. C. Dopamine. D. Adrenaline. Ans. Metoprolol selectively blocks beta 1 receptors, reducing cardiac workload. Q897. Which drug is used as a uricogenic agent in gout? A. Probenecid. B. Allopurinol. C. Ibuprofen. D. Aspirin. Ans. Probenecid increases uric acid excretion through the kidneys. Psychotic drug has the highest risk of agranulocytosis? A. Haloperidol. B. Clozapine. C. Risperidone. D. Olanzapine. Ans. B. Explanation. Clozapine bone marrow suppression करके agranulocytosis cause कर सकता है. Q2. Lithium toxicity commonly occurs with which diuretic? A. Furosemide. B. Mannitol. C. Thiazide. D. Acetazolamide. C. Explanation, thiazide lithium excretion कम करके टॉक्सिसिटी बढ़ाता है। Q3. Which antidepressant is also used for smoking cessation? A. Fluoxetine. Bupropion. C. Amitriptyline. D. Sertraline. B. Explanation, bupropion dopamine और norepinephrine reuptake inhibit करके smoking craving कम करता है। Q4. Neuroleptic malignant syndrome is mainly associated with A. SSRIs. B. Benzodiazepines. C. Antipsychotics. D. Opioids. C. Explanation, dopamine blockade की वजह से NMS develop होता है। Q5. Which drug is preferred in status epilepticus agency? A. Diazepam. B. Phenytoin. C. Ethosuximide. D. Carbamazepine. A. Explanation, diazepam rapid CNS action से seizure control करता है। Q6. Action occurs with which drug group? A. SSRIs. B. MAO inhibitors. C. TCAs. D. Antipsychotics. B. Explanation, tyramine containing food के साथ MAOI लेने से hypertensive crisis होता है। Q7. Which antiepileptic drug causes gingival hyperplasia? A. Valproate. B. Phenytoin. C. Lamotrigine. D. Levetiracetam. B. Explanation, phenytoin long-term use से gum enlargement होता है। Q8. Which opioid is used in opioid dependence treatment? A. Morphine. B. Methadone. C. Naloxone. D. Codeine. B. Explanation, methadone long-acting opioid substitute therapy में use होता है। Q9. Which drug is a selective serotonin reuptake inhibitor? A. Imipramine. B. Fluoxetine. C. Haloperidol. D. Chlorpromazine. B. Explanation, fluoxetine serotonin reuptake inhibit कर depression treat करता है। Q10. Tardive dyskinesia is mainly caused by prolonged use of A. Antibiotics. B. Antipsychotics. C. NSAIDs. D. Antihistamines. B. Explanation, chronic dopamine receptor blockade abnormal movements cause करता है। Q11. Which benzodiazepine is commonly used as preanesthetic medication? A. Lorazepam. B. Midazolam. C. Alprazolam. D. Clinazepam. B. Explanation, midazolam sedation और anxiolysis के लिए ऑपरेशन से पहले दिया जाता है। Q12. Which antidepressant has maximum anticholinergic side effects? A. Amitriptyline. B. Fluoxetine. C. Sertraline. D. Escitalopram. A. Explanation, amitriptyline TCA होने की वजह से ड्राई माउथ और कॉन्स्टिपेशन ज्यादा करता है। Q13. Which drug is antidote for opioid overdose? A. Flumazenil. B. Naloxone. C. Atropine. D. Physostigmine. B. Explanation, naloxone opioid receptors block करके respiratory depression worse करता है। Q14. Absence seizures are best treated with A. Phenytoin. B. Ethosuximide. C. Diazepam. D. Carbamazepine. B. Explanation, ethosuximide T-type calcium channel block करके absence seizure control करता है। Which antipsychotic commonly causes hyperprolactinemia? A. Risperidone. B. Clozapine.